Hi everyone, my name is Dinesh Surasena and I'm a consultant in sports and exercise medicine. I use ultrasound regularly in my clinical practice, and today we're going to be talking about the glenohumeral joint and in particular imaging it. As in some of my previous talks, I've mentioned about some of the resources that I use when I'm giving talks or presentations, and I really recommend ultrasoundcases.info and the ESSR guidelines for shoulder scanning. Here's the pictures from the ESSR guideline on scanning the glenohumeral joint. On the left, you can see the position of the subject, and the red line represents where you should place the transducer. On the right, you can see the glenohumeral joint with the deltoid overlying, the infraspinatus next, the humeral head, and then the glenoid with the labrum identified using the white arrows. When I'm imaging the glenohumeral joint, if it's just for general scanning, I usually have the patient sitting upright, and this is basically because it allows me to move the arm around a little bit more freely. However, if I'm planning for an injection such as a hydrodilatation or just a straightforward steroid injection into the glenohumeral joint, I tend to have the patient lying prone. This is both more comfortable for the patient and also confers a lot more stability for me as the clinician when I'm scanning and also performing an injection. When I scan the glenohumeral joint using the curvilinear probe, as you can see in the previous slides, this is the image that you might typically get. First of all, it's important to recognize that it is from a curvilinear probe, so the clarity may not be as sharp as with a linear transducer. However, you can see quite a broad area of the anatomy, including more of the humeral head. You can see the glenoid, and you can see the joint quite clearly here. And it's very useful when you're trying to assess for an effusion, an obvious tear of the infraspinatus, or if there is any significant degenerative changes in the joint itself. Well, I hope you all enjoyed the video, and it adds to your knowledge of musculoskeletal ultrasound imaging and interventions and how you can use this in your clinical practice. If you did, please remember to hit the like down below and subscribe to the channel for further updates. You can also follow me on Twitter and Instagram, and please check out sportsmedinfo.sg, which has lots and lots of useful information for clinicians and patients alike. I hope to see you all very soon, so take care for now. Bye-bye.